Hi, this is Dr. Dan Beatty from evetclinic.com. Today I'm demonstrating a chiropractic adjustment on this saddlebred show horse. Do not attempt this on your own. I am a veterinarian and I have been trained and certified to do chiropractic on animals. I have over 12 years of experience in doing this on horses. Right now I'm testing out the neck, looking at the neck, seeing how it moves. Especially in this horse, as a saddlebred, needs good carriage to its head and a nice supple neck. If you are looking to have this done, be sure to find someone that has had proper training. The easiest way to do this is through the American Veterinary Chiropractors Association. This is the association that certifies veterinarians and human chiropractors to do chiropractic on animals. There are only a handful of schools in the world to train at, but all of them follow the guidelines that the AVCA has set forth. They require about 200 plus hours of education, along with case studies and tests to be sure that you are capable of doing chiropractic treatment on animals. Another reason that it's important to find someone who is certified by the American Veterinary Chiropractic Association is that they require continuing education to maintain the certification. So if a veterinarian or a human chiropractor that is certified by the by the AVCA, by the American Veterinary Chiropractic Association, they have continued their education even past the initial training that they received. Now you may be asking yourself, why would I need my horse to be adjusted? Especially this horse, it doesn't look to be having any physical problems. Well, in this case, this horse is a show horse, and it does go through a lot of physical stress from training and from showing. The purpose in this case is to have the horse as comfortable and moving as best as it can so it can perform better in the show ring. Making sure that the horse is flexible and all the joints are moving effectively and efficiently. Now, in some cases, I'll also be working on horses that do have a physical problem. The reason why I would be working on them is that, let's say, for example, if the horse has a lame front leg, the chiropractic is not going to be specifically treating the lame front leg. Most of the time, the veterinarian is going to be doing that. What the chiropractor does is corrects the rest of the body because the biomechanics of the horse are messed up because obviously the horse is not walking effectively or efficiently overall. So it's putting a lot more stress on other areas of the body to compensate for the lack of movement in the one leg. Now, chiropractic treatment corrects these joints that are not moving effectively or efficiently um, by finding the joints and then by applying a high velocity thrust to that specific joint in a specific motion. This basically resets the joint trying to acquire normal movement. Now, it may need to be repeated depending on the severity of the problem. And also, in this case, the horse is going to continue the physical stresses on its body because that's what it does for for the living. Most of the time on these show horses, I'm coming out once a month to the barn and doing a treatment on them to help keep them as moving and as comfortable as possible. I also recommend massage and stretching to help maintain the movement by treating the muscles and the other soft tissue structures surrounding the joints. A soft, supple, more flexible muscle is a much stronger muscle. It'll also help keep the horse comfortable and as powerful as possible. Along with the chiropractic adjustment, in order to maintain the horse's movement, we'd also be looking at the horse's shoeing, the horse's dentistry, and also the tack fit, making sure that the saddle fits appropriately. In fact, a lot of times in my experience, what I've discovered is that people have me come out and take a look at a horse that has a sore back, and it's not really a chiropractic problem, but rather their saddle is not fitting correctly. So I will still do treatment on that horse to help bring it back to comfort, make sure that the joints move as well as they should, but the underlying problem is actually the poor saddle fit. So as a horse chiropractor, I will be looking at these areas to help determine the underlying causes of the ineffective movement of the horse. I hope you enjoyed this demonstration. This is Dr. Daniel Beatty from evetclinic.com. If you have any questions or comments, please contact me there at evetclinic.com. Thank you.